you have some in Ottawa, some in Montreal, some in Vancouver, in major urban centers. Now, in terms of the COVID-19, I haven't heard of any patient with thalassemia having symptoms or having the virus, unless I wouldn't be able to know because it's a lot of patients across the country at many centers. Now, the country has been responding very well. They're doing quite well in terms of keeping the numbers of infected people low, and the number of deaths is actually very low in Canada. So this is good. A lot of people are respecting the social distancing, following precautions. A lot of people are working from home or not working. Thalassemia patients are still getting their treatment the same way as always. When they go into the hospital, they are screened. They are asked questions twice at the entrance and again once they get to the clinic. Now, they are also practicing social distancing at the clinics by keeping distance between the patients, the minimum of 2 meters. The nurses are wearing masks and gloves, and again, they are doing their due diligence in keeping safety, as number one. In terms of the blood, we haven't had blood shortages. What we had was a decline in the number of donors, which was quite sufficient to trigger alarm. And that happens, I would say, in the second or third week of March, that it triggered an alarm, and we started to call people to donate blood across the country, and the donors responded quite good. The only thing what happened is that decline in the donors had triggered a green phase, which is basically a cautionary phase, and a lot of hospitals and with the blood, they started to use blood conservation. What do you say it? Regimes. So they start to not to transfuse if people have don't really need the transfusions and delay the surgeries. Now, what happened is
it's called patient management products. Yeah.
Yes, yeah, blood management. They try to follow that. And what happened is actually one of our patients who is at a smaller hospital was told that she might get less blood a week in advance. And then the time to get blood, she was denied, and she was told, oh, we don't have blood. Like first she was given different excuses, then she was told you don't get transfused till your hemoglobin is below 7, which is not acceptable. So then we tried to to get her to go to a different hospital to get her blood, which we managed. But that raises a concern for me and for many others that you can't treat patients with thalassemia under these guidelines. You have to follow the best practice guidelines for thalassemia, not the best practice guidelines for the regular population. And the other concern that is raised is, what do you do if that hospital or that center is not available because of a virus outbreak or shut down or whatever? So that's where we don't know what are the plans for that, but I will be investigating into this and advocating to sure that we have plans in place. Specifically for where do patients go in case of the place shut down, and also ask them that to maintain the best practices for thalassemia, or not to apply those guidelines they have for the regular population on thalassemia patients and other anemias who have life dependency on blood.
Yeah.
Okay. But okay, Canada seems to be a well-organized country. Seymour, what about Azerbaijan?
Not only a well-organized country, but a well-organized Thalassemia Association. Well done, the Canadian Thalassemia Association.
To be honest, Andrew and Dr. Nguyen, I'm very, very pleased with the materials you guys have provided. Yes, I have been sharing that through all our patients through e-blasts and emails on websites and on Facebook through social media, and they have been very helpful. It's been a great source, so I'm really happy with that, and we will keep communicating with the patients. Okay. Seymour, I guess it's your turn. No, we can't hear you.
We can't hear you.
Hear me?
Now it's good.
Hey everyone again. In Azerbaijan, we haven't any case COVID-19 with thalassemia or sickle cell disease till now. For our government, for the stop the spread of virus, we try to keep our population to home. We are in all of the country in quarantine regime since early of March. In our country, all the cases till now is 900 approximately. And the main problem is also the blood shortage for Azerbaijan. We can try to some social advertisement for blood donation and secure a poll donation for our patients and try to do some things, but the time is hard for us also.
It's a very big problem. How are they addressing it, Michali?
Actually, at the moment, there's no shortage in Azerbaijan, but Semur and the association are actually trying to encourage more donations. Is that right?
Yeah.
Sorry, I couldn't hear you.
Say it again.
Sorry, I was just explaining that in Azerbaijan at the moment, no blood shortages, but the association is trying to promote more blood donation. Is that right?
Yes, we try to do everything for blood donation, but we have blood shortage because the quarantine regime, our people fear for the virus, go to clinics for blood bank, for blood donation. But we try to everything for solve this problem as an association.
So, pentru că hemoglobin, πόσο πέφτει το hemoglobin?
Are you still, Semur, are you still being transfused at a reasonable hemoglobin level, or are patients having to wait for a hemoglobin to fall below 8 or something?
In the capital of our country, we don't wait for it. We can find blood, but in the regions, the problem is bigger than the capital city. They wait, unfortunately.
Have you, again, Simon, have you received or have you seen the material that TIF has produced?
Yes.
And do you find it useful? For example,
yes.
I think some of it has been translated to Turkish, and therefore it can be used to be promoted to the doctors and the hematology center, and it might be useful for them too.
Yes, we use your every publishing materials. I sent all of our Thalassaemia centers doctors and staff the useful links, useful publishings, and I believe they use them.
Yeah. Okay, Semur, thank you for the time being. Let's go. What about Anisa? Anisa Mima was there, and she was.
I am here. Yeah.
Yeah, she was waiting for a long time.
It's not a problem.
Anisa, are you speaking?
Wait a minute, Mikhail. Did we ask the Azerbaijan if there was any information with thalassemia? How many?
None.
None. Okay.
Anissa, what are you representing Germany right now, or are you going to talk about Albania?
This is a good question. Well, I had this invitation, and I'm pleased to talk about what I know about Germany, and of course my experience, because we don't have any association here in Germany which is really working in
unison. Yeah.
Yeah. Exactly, but I have also invited my brother George Yergi, is also online. Maybe he can talk better about Albania, because he's living there and he's taking his transfusion regularly then, and it's maybe better if he talks, and yeah.
Okay,
I'm talking about Germany.
Germany, right? Okay.
Yeah. Yeah. Well, in Germany, it's a good health system in generally speaking, and we everywhere it's now they are screening also a lot of patients. But not, of course, not typically thalassemia patients. I have not been screened in my clinic where I have the regular blood transfusions. We don't have any screening protocol. We are not being asked if we have symptoms of COVID. Yeah. But we are still having a regular blood transfusion. I had to postpone my appointments. It's very difficult in this situation to go and take the, for example, to have an MRI or to have this periodic controls, let's say, but we are having blood regularly.
Okay.
And there are no cases reported with thalassemia. I have spoken with Dr. Grosse, and she has no information about.
That's very good.
Cases. Yeah.
But the important thing that we would like you as members of the Community Advisory Board of TIF is to have your eyes open and your ears very stretched, so that if we hear, we know how this very strange and new virus impacts.
Yeah.
My sort of premonition is that it will not affect thalassemia in a worse situation than in non-thalassemic patients, except those with heavy comorbidities, you know, diabetes, respiratory problems, cardiac. But the well-treated ones, I think, will be quite as resistant, the majority, as in the other population. But please, have in mind, your ears open, and we'll be very, very interested to receive information and pull it together.
Yeah.
Thank you.
I was initially very, very concerned, because I'm working as a doctor here in Germany, and it is, of course, I'm in contact with every patient, and I am maybe very, very risky, and I had this, I was scared and afraid, should I continue to do my work or not? Well, I have talked with Dr. Grosse, my hematologist in Hamburg, and she assured me I should work, and I'm working, and it's okay. It's okay.
But Anissa, I hope that you are taking extra precautions. For example, when a patient comes You wear a mask.
Of course. This is happening. This is happening in my in the clinic where I do the blood transfusion. Every patient and every nurse and every doctor has this mask, and yeah.
But I think, as you said at the beginning, Germany is, well, we are very impressed because Germany has a really robust health infrastructure. Yes. These measures of healthcare professionals have been taken from the beginning.
Yes.
Contrary to other countries where healthcare professionals are heavily affected.
Yes.
So well done, and please keep in line with us and let us know.
Yes, of course.
Let's go to your brother then, Georgie.
Mm-hmm.
Albania, we really need to hear about what.
Hello.
Hello.
Hello, Georgie from Albania.
Uh-huh.
I don't have, sorry, but I don't have a camera.
No camera, okay.
Because I don't know, it's, something is wrong with my PC. And I want to tell you that here in Albania there is no patient with Thalassaemia that has encountered the COVID virus, COVID-19 virus until now. Let's hope this remains so. But there is a shortage of supplies of blood because from the center of the donors here in Albania, there was a doctor that said a week ago that they had just 2 days supplies for blood, and then there were a lot of institutions like the President of Republic and the policy of state that has donored blood, and now there are a lot of people that want to donor, but here we in Albania have strong measures. We are allowed to go outside of our houses only 1 hour in day, and to get out of our homes we need to get a special permission from a government portal, e-Albania it's called, and we must enter in this portal, and we had to get the permission. So a lot of people are having trouble in this just 1 hour time to get and to do their jobs of the day, but also to donor blood. So this is a preoccupation for us here.
It's the same. It's the same in all countries.
Yeah. In some countries, the authorities issue a special pass for blood donors. Has this happened in Albania? I mean, if you want to donate blood, can you request either from the police or some authority?
Yes. Here in Albania, the center of the donors tells to the people that they can go to their houses and take them with ambulances and to bring them to the center to donor blood. This is possible.
Mm-hmm.
That's a service. That's a very good service.
Here in Albania, there are not so much people affected with COVID, just 417, if I'm not wrong. Today must be 417 people affected with COVID. And we think that we are now at the end of let's say of the epidemic, but we are still at home this week. The next week, the government has said that the measures will be a little bit more.
No, Italy no.
Okay. Thank you very much, Bobby.
We were worried about Romania for very long. We haven't heard. We are very happy to see that the number, is a very small number. Let's hope that it's really towards the end and not the beginning. Sometimes it's very curious how the epidemic works in a country. Yeah. Okay.
We had the first case at 8 March, and now we have 417 cases.
And how many deaths? How many deaths?
Sorry, I didn't understand.
How many deaths?
There are 2003. 2003. 23. Sorry, 23 deaths.
Okay.
23.
Almost like Cyprus. Yeah. Thank you very much.
Thank you.
Okay. Who's next? George.
George, hello.
Where are you?
George?
Yeah. George, do you hear?
You sound very far away.
Hello,
Hello. Hi.
can you hear me now?
Yeah, we can hear you.
Oh, excellent. Okay, okay.
We can even see your head now.
You can? Oh, okay, that's me. Yep, with long hair. I need a haircut, but
Yeah.
can't get out. So I'm gonna have as long. My hair is gonna grow as long as Andrullah soon.
Hello, Yorgo. Hello,
He's
George.
down.
Yeah.
Hello.
Hi.
Okay, in England, things are.
About the UK.
Here?
Okay, in England, basically, I can only tell you about the Whittington. I'm not very familiar with what the others are doing.
Yeah.
But to be very honest with you, Andrullah, asking the patients whether you've got patients who have contracted the virus, they will not be able to give you true figures because the doctors do not tell you. When you ask them directly, they say, well, yeah, we'll see, and all these things. They don't actually tell you the exact problem. So you've got to keep that in mind. The only people that you could possibly get some true figures is if you go to the doctors directly, and they will give you unofficial.
Yeah, of course. We have sent the doctors, George.
Yeah, I've seen that.
But the question is,
Why between you? Sorry, but between your peers, you don't recognize when there is somebody with a disease or the symptoms or whatever.
Okay, the way that Whittington Hospital works right now, and that will show you why it's very difficult. The Whittington Hospital has now moved from its normal center to a building outside the hospital, so the patients do not have to go in to the hospital at all, which is brilliant. This was the tuberculosis center, and they are using the same facilities. Tuberculosis is only done on one day, and therefore the other 4 days is used by the Whittington Hospital Thalassaemia unit on sickle cell.
Mhm.
It's open from 9 in the...
Well, can't hear you.
George?
George, I hope you're not still talking because we've all gone deaf.
Everybody leaves at 12:30. Sorry? Hello?
So it's open from 9 o'clock to what?
To 7:30 at night.
Okay.
So that way what they've done is they've allocated 3 shifts of blood transfusions. So basically you've got people coming in until 12:30, they all go away. The next session comes at 1 until 4:30, they go away, and then the next session comes and they finish at 7:30. So you don't get to see many of the patients. They're trying to keep the contact between patients as little as possible.
Okay.
We've had 2 of our nurses contact the virus, and they were isolating for a week or 2 weeks. So the question whether you have any patients or not positive have, but we don't get to know. I didn't get to know, or other people that I speak to didn't get to know.
You know, they don't get a what?
You don't get to know the other patients.
Okay.
Yeah.
The other thing that the Whittington has done is to identify about 15 to 18 very vulnerable patients.
Home transfusion.
And women that are pregnant, and 1 or 2 other patients who are vulnerable, and they've organized home transfusion. That's very, very important, especially if you're trying to keep some people who are very vulnerable, like the pregnant ladies, away from any possibilities.
Yes.
Blood transfusion, there is no problem in England, but what there is in the government information that they keep putting on the TV every day, they are reminding the donors that you if you donate blood, that doesn't necessarily mean that you're going to get automatically the test of the virus, because lots of people confuse. They thought if I go and give blood, then they will test me before I give blood. That does not happen.
Like
Also,
like HIV story, yes.
Correct. It doesn't work that way.
Yes.
The other thing that they are continuously advertising is that it is safe to be a donor, because people think that if you go into the hospital to be a donor, it's possibly not safe. How many people, you know the figures in England, how many people have died? We're nearly 10,000, very close to the 10,000 mark. They've just finished building a hospital in central London, which will feed about 5,000 people. They're doing the same in Birmingham and Manchester and so forth. So there seems to be the heavy things are still to come in England.
Yeah, but George, I am very curious to know, in London or in the UK, don't they follow a sort of uniform measures in the hemoglobinopathy centers?
Yes, we've got the hemoglobinopathy forum has actually published a guidelines which distributed.
I'm on a webinar.
I've sent. I think I did. The UK. Huh?
On a webinar. Would you like to answer?
Sending, and they sort of do webinars as well. And they also, I think they've distributed your information that TIF has sent to them. So there's a lot of information going around for the patients in England. They're also getting lots of information because there's a lot of communication between the American patients and Cooley's anemia. So we're getting information from everywhere, which is, I don't think there is a lack of information. The only information for me, which is not coming, and I don't think anybody can answer, is that me personally, I don't think this thing is going to go away for another maybe 9 months to a year, maybe even longer. So I don't know how this thing is going to continue with the patients and with the methodology that they have to follow. That's the question that sort of baffles me, and I don't know anybody. And what can we say to the patients? Because you've got to keep them engaged.
George, I think that TIF has to take a position on this very, very important question, to advise the hemoglobinopathy centers in the countries and the ministries of health that at least for these patients, the hemoglobinopathy patients, as well as the transplanted patients, these measures should be kept at least for another 6 months. This should be a position that we should all decide on, but my feeling, and of course we will talk with the healthcare professionals and the experts and of course the patients, you yourselves, you have the first role is that we should advise governments whatever measures are relaxed for the rest, for the vulnerable groups of patients should be kept at least for another 6 months, at least at the treatment centers. I mean, the relaxation taken to go to a supermarket or to go to a funeral, and then again, not so much relaxed, but at the treatment centers, what you have just described for the 3 levels in the morning, in the afternoon, and until the evening, spacing out the patient's transfusions, transfusions at home and everything. I think this has to be kept for the rest of the 6 months. Okay, thank you.
Yeah.
Can you find out what is happening in Manchester? Of course, we will write to our friend, the Manchester people over there. But since you are our cub in this, I think you have the authority of TIF to actually liaison with these people and get back to us.
Okay, the good thing, Andrula, is also if you communicate directly with the doctors, you've got most of them, most of the doctors. I know they don't answer very easily, but they will give you, or rather, if they see that you are pursuing them,
yeah,
they might start thinking positively on what action to take, which is possibly better, because I don't think anybody else is thinking this innovative way like the Whittington Hospital is.
It's a good thing that now patients and TIF and the doctors can take over and not the industry, because
yes,
all the other data we've been trying to collect through the decades were a privilege of the industry or of whatever. Now we need to unite together and get this information from us for the benefit of the patients.
Yes, I agree.
Okay.
Thanks a lot, everybody.
Thank you.
Thank you, George. Since we already covered part of Germany, what about Dr. Misri? Are you on the line? Because another thalassemia doctor, patient and doctor, is in Berlin.
Yes, I'm in the line.
Hello. Let me see.
Hello.
Misri, many years since we last met.
Hello, Miss
Yeah, like 2016.
Yeah. How are you? What's the situation in Berlin?
Well, like Anissa said about shortage of blood transfusion, it don't exist. There are normal blood transfusions, but about screening, like about telling information for patients when they are going to transfuse you to make the transfusions or anything, nothing. Like it's just normal. The patient come in without asking him, and he takes the transfusion and he come out. Like there is no really extra history taking because of COVID or anything. But in the hospitals, like because I'm working in 2 places, I'm working in the Charité hospital, and in this hospital, because there are lots of equipment, so all the people are using surgical masks, like the doctors and the patients, and like they have lots of masks and reserves and anything, so there should be no problems. But it's surgical, like the doctor wear a mask and the patient wear a mask, so it's okay. I'm also working a part-time in a clinic, like a private clinic, but there is no there is no much equipment. We have to bring our masks ourselves, and like it's like a small private sector. About the number of patients, 120,000, and the deaths are 2,500 till now. They are doing like relatively lots of screenings, and about like all the people work from home, like as much as they can, but also about the restrictions to go out. They have this law that it's not allowed for more than 2 to walk together. but the people now, because of the sun, they are like getting happy and they want to go outside a lot, which is scaring me actually. Yeah, that's all. And also about because also I'm working in Charité in this stem cell facility, so like which deal with allogenic and autologous transplantation. So it's like kind of blood product, also like it's stem cell product. We were thinking what is the safest way to ensure that this stem cell product will not have corona. What we do, it's normal, like we just like 20 years before we examine the donor, and like after 20 days he donate. We ask him, do he have corona or any history for corona, and when he say no, and we tell him like please contact us if you have any symptoms of common cold or corona like symptoms. And when he donate, we re-ask him again, and then we ask him after donation, like after in time period of 14 days, if you develop any symptoms, please tell us, and that's all.
Yeah, this is what we call the post-donation investigation, which is very important. I think it's very important for transplant donors, for organ donors, but also it is important for blood donors post-donation, because they give a donation, and post-donation monitoring of what they develop is very important. It's mentioned also in our TIF guides for blood. Okay, that's very good.
Mohammed, one question. You mentioned 2,500 patients. Is this all thalassemia patients?
And no, thalassemia patients. It's also because in Germany, as Nisa said, it's always this problem with thalassemia. There is no really a strong organization or enough data or anything. But I didn't hear about thalassemia patients who got corona. So it's just 2,500 normal people are the death toll, but thalassemia, I don't have any numbers because there is no place to get real numbers outside just the people you just know personally.
All right. Okay, man. Who's next? Vasily from Greece. We're on the G's now. Vasily Masakous, do you hear us?
Μια χαρά. Βέβαια θα πω μια καλησπέρα απλά, θα σας τα πει η Στέλλα που έχει συνδεθεί και αυτή. Για όλους. Η κατάσταση εδώ είναι υπό έλεγχο. Υπάρχει αίμα καλύτερα και από άλλα χρόνια, μπορώ να πω, για τις μεταγγίσεις. Λαμβάνονται μέτρα στις μονάδες και φαίνεται να γίνεται μια καλή δουλειά. Δεν υπάρχει κανένα σύμπτωμα.
Βασίλη, ευχαριστούμε πολύ για αυτά που έστειλε σήμερα.
Ακριβώς.
Ευχαριστούμε πολύ. Να το πούμε αυτό πρώτα και πάνω απ' όλα. Και σας ευχόμεθα κάθε καλό.
Η αλήθεια είναι ότι αυτό που είπε και ο Γιώργος πιο πριν για μετάγγιση στο σπίτι ήταν ένα σχέδιο που θέλαμε και εδώ να εφαρμοστεί, αλλά μάλλον δεν υπάρχει ανάγκη. Είμαστε πολύ καλά και υπό έλεγχο όλα.
Ναι.
Στα αγγλικά και αναλυτικά.
Και ανάγκη και πρέπει να υπάρχει και πολλή υποδομή, Βασίλη μου, για να γίνει αυτό το πράγμα. Δηλαδή να πας στο σπίτι, να το πάρεις, να το κάνεις με cross-matching, μετά να ξαναπάει. Ευτυχώς που δεν υπάρχει ανάγκη, γιατί η υποδομή θα ήταν ένα πολύ σημαντικό στοιχείο στην απαγόρευση αυτού του μέτρου.
Okay, Vasily, anything else? You have adequacy of blood, no problem at the moment, no infected patients that you know of. I should tell everybody that we have very little information, but I know of about 4 or 5 patients in Italy, 1 patient in Cyprus who have been infected, and they have done very well. They have done better than the general population. So at the moment, the information that we're getting from various sources seems to be that the thalassemia patient does not get worse than others at the moment. But
I think some anonymous information that we have, or some information we have without giving a name and a country, and I'm not allowed to do that, is that, as Michael said, the impact of this virus on thalassemia seems to be mild, and in extreme cases, respiratory is the case, and they give preliminary and prophylactically some antibiotics and respiratory, and they all go very well until now. I've been given descriptions of 4 thalassemia patients. As I said, I cannot disclose where and how, but the impact of this virus seems to be very mild on the thalassemia substrate. If, of course, people are well chelated and well transfused, and this is where we need to focus. The adequate supplies of blood, continuation of iron chelation and monitoring. This is as important as the coronavirus infection. Βασίλη, μου είπα ότι 2-3 περιπτώσεις που είχαμε και μας έχουν στείλει πληροφορίες ανώνυμες που δεν έχουμε την άδεια να τις πούμε ονομαστικά ή κατά χώρα, φαίνεται ότι είναι μια ήπιας μορφής ή τουλάχιστον της ίδιας έκβασης, κλινικής έκβασης, όπως και σε μη θαλασσαιμικά υποκείμενα στρώματα, εκτός σε βαριές comorbidities, όπως είναι ο διαβήτης και αυτά που γνωρίζουμε για τον καθένα. Ώστε we keep our fingers crossed. Επίσης και με την ασφάλεια του αίματος και με τη μεταδοτικότητα του ιού φαίνεται να είναι μια θεωρητική άποψη και όχι πραγματική, ώστε ας περιοριστούμε, είπα, στη συνέχεια της καλής θεραπευτικής αγωγής. Αυτό είναι πολύ σημαντικό να αντιμετωπίσουμε το coronavirus.
Vasily, can we now move to Stella to continue the story of Greece? Stella, are you there?
Stella has something else to tell us than Vasilis.
They have to know in English. Audience.
Stella?
Βασίλη μου, σήμερα βγάλαμε και ένα έγγραφο για την ασφάλεια του αίματος και όλα τα υπάρχοντα στοιχεία.
Should speak in English for others.
Ναι. Όλα τα υπάρχοντα στοιχεία για την ασφάλεια του αίματος το έχουμε κάνει upload στο website. So, as I said from the beginning, today we have uploaded on our website blood adequacy and safety. All the documentation and sort of information around this subject was in the literature. So, please look at it and... Okay.
Who Stella is not responding? Okay, that's all right. Kostas Tsurlis from Germany as well. How about you, sir? Kostas?
Kostas, do you hear us?
Hello?
No.
Hello.
Yeah, we hear you now.
Hello to everyone. Hello to all my friends and Dr. Michael. Yes, we have, I live in Bavaria, so I can share the opinion of my fellow thalassemics, the 2 from Germany, while I have heard also different things, and I think it depends on the state where you live. So we seem to have a decline, kind of shortage of blood units in the beginning of the crisis. But then they made some official statements. They had an essay in the Frankfurter Allgemeine Zeitung, so in the newspaper, and this was solved, I think, quite good. It depends on where you get your treatment. So I have heard different stories. For example, that patients went to the regular transfusion and had a hemoglobin around 9, and whether they had been asked to come a week later or have been given lesser than normal, and It was in one case that a patient, a friend of mine, she was at 8.9, had given only 2 units and had been asking to come a week later, and then she dropped. No, sorry, she had been given only 1 unit and had been asking to come a week later, and then she had dropped to 7.9 already. So these cases do also exist. I cannot say this for my own. I just have been asked to leave more space between the cross match and the transfusion, so they have more time to collect some blood. But up to now, there were, for me, 2 transfusions, and they were regularly, so I had enough blood. As for the security, and I have to say this, that I live in Bavaria, and we have the most strict regimen in the health system compared to the other states of Germany, and also as far as this shutdown. So let me tell first about the hospital. You will write at the entrance. We have been asked whether we are a patient or not. If you're not a patient, you are not allowed to enter the hospital area. No visitors, no nothing. If you're a patient, you will be asked if you were on holidays, if you have fever, if you have some symptoms, if you feel any dizziness or weakness, then you get a mask and you have to wash your hands and clean it with alcohol. They have minimized the oncologic patients only to those who have MDS or thalassemia, so who really need their blood or who really need their chemotherapy. All others are not are postponed to after the crisis. So the room where we get treated are quite empty. We have much space in between us, so at least 2 meters. And it's almost the half of what I usually see there get the treatment. While all the time wearing masks, the doctors and the nurses also wear their masks. And so far for the treatment, the problems I have heard about were that especially for patients with splenectomy, they have some difficulty to find the pneumococcus vaccination. I don't know if this has been solved yet, but at the first, when the media and everyone start to say or to recommend that thalassemia patients should get vaccinated if they don't have their spleen, they have some difficulty to find the vaccination. Some of them even order it from the internet and online. That is the one problem. The other is, of course, that many are very concerned. They don't know when they are diabetics, when they are splenectomized, what can they do? They don't dare to leave their apartment. In general, our life here is that it is minimized to, you are allowed to go to the grocery store to go buy some food, and you are allowed to go for a walk, but only alone. So in Bavaria, it is even more strict. Only people who live together in one apartment are allowed to be together, even outside. So in my case, for example, I'm not allowed to see a friend or anyone. Since yesterday, after we have many protests against the police, it is also allowed to sit on a bank outside in the park and read a book or just have an ice cream or something. I respect all the situation. I just have one last thing to say, that what concerns me the most is the psychological impact this will have to all of us, not only to the thalassemics, but to all of us. Yeah, so far I think that's all I have to say.
Thank you very much.
Thank you very much. I think Germany has been one of the exceptional countries in Europe after Greece, of course. And may I comment on Professor Chodras that we are following him and τον καθηγητή τον δικό σας, τον λοιμοξιολόγο, τον κύριο Τσόδρα. Τον παρακολουθούμε πολύ στενά και μπράβο, it's one of the times that, you know, Greece has taken the lead in this. And you know, Kostas, really, having said the psychological aspect of the whole pandemic, which is very important, although it has its dark sides, all this pandemic may bring about some other issues of our healthcare systems and of our global priorities, because priorities have been on the wars, on the nuclear, on everything, and we were not prepared. No country, despite the infrastructure, was prepared for such. And I think that this has brought a new environmental conditions, has brought new priorities in our lives that are never going to go out, actually, even if these guarantee measures are released. Αυτό που λέω, Βασίλη, είναι ότι έχει φέρει πολλά νέα δεδομένα και νέες προτεραιότητες στη ζωή μας αυτό το πράγμα.
Okay.
Maybe we will appreciate more normal things in our life from now on. Things that seem to be pretty normal and not really appreciated, like just having a walk and ice cream and whatever, and meet friends.
Okay. So, actually, on the psychological point of view, is Stella anywhere near? She's a psychologist. Where is she? No. Stella?
Έχει πρόβλημα με το μικρόφωνο.
Okay.
Okay.
Δεν μπορεί να μιλήσει. Ακούει, αλλά δεν μπορεί στο παρόν. Δεν το έχει λύσει.
Okay.
Περιμένει να δω, Στέλλα.
Okay. Okay. Maybe we should go to Turkey. Welcome.
Hello.
Still with us?
Hello.
Stella.
You can hear me now.
Yeah.
So
now I hear you.
I've changed the laptops. You had a problem. So.
Stella, where's your pretty face? Where is it?
It's here now. I will open my camera too.
Hello. We see you.
You can see me now. Okay. So, as Vasily said before, the blood donors were very touching because they corresponded very well until now in Greece. So, we have a blood sufficiency better than ever. What else would you like me to tell you? We have the transfusions in the thalassemia units. We have a special room which is characterized as a room for all the patients which have symptoms and they might have coronavirus. All the doctors wear masks, all the patients wear masks, all the patients also wear special covers for their feet, for their shoes, so that they don't they don't pollute the thalassemia unit. What else? We have 2, maybe 3 shifts per day for the blood transfusion. It depends on the day and the number of the patients every day. What else?
Kostas mentioned the psychological impact of isolation, I guess. Have any of the patients expressed some kind of nervousness, depression? How is this? Is this something we need to really deal with?
We have to deal with it as all the other normal people. It doesn't only thalassemia causes anxiety and stress. Everybody is more stressed right now. Everybody is more anxious. But the thalassemia patients do have extra reasons to be more stressed. In Greece, we have support groups via teleconference, via Skype, or any other kind of meetings for the patients in general, and especially in our association, the Greek Thalassaemia Association. We have made a group of social health professionals, or psychiatrists or psychologists, who are offered and are willing to help the other thalassemia patients who all have problems.
Okay, excellent. So this is something that maybe other groups should imitate. Can we go to Volkan now?
Sorry, it's George. Can I interfere for a minute? There seems to be is that okay?
Okay, George.
Yeah, it seems to be a very dispute between wearing masks and not wearing masks. It seems that people think that wearing mask is useful. There are very professional people who say that wearing masks is actually makes things worse. Is there something that we can
differentiate this, George?
Differentiate? Yes, yeah. Apparently the wearing a mask, if you are not have the coronavirus, the problem is that when you're taking the mask off, there is a specific method of taking the mask off. So if there is any virus on the outside, you don't basically bring it on the inside. Also, if you're wearing a mask and you're going anywhere near somebody who is infected, the attempt is for them to be protected, not you, because they should be wearing the mask. The problem is that these masks that everybody has, these paper ones, by after an hour or an hour and a half, they're pretty useless because they've become so soaked, and therefore they do not perform any protectiveness. Yeah. So people Whittington Hospital, they do not wear masks, the nurses don't wear masks, the doctors don't wear masks, and the patients are beginning to say, well, why are they not wearing masks? Some of the patients go there fully clothed, gloves, masks, the whole shebang, and there is a continuous misunderstanding of what's going on. Now, is that something that TIF can actually investigate a bit more?
We must explain the issue of the mask at the beginning was a problem of shortage of techno material. So the governments were saying that it's very safe or it's better the mask to be worn by those who are infected with the virus so that they cannot transmit it. But the problem is that not only the symptomatic ones are the ones that can transmit, is that also the asymptomatic.
Correct.
Because Michael whatever, and Royce or whoever, you know, we walk around without any symptoms, but we may be asymptomatic, and that will be able, although very rarely or to very small numbers, the asymptomatic can transmit, because if you are asymptomatic, it means the viral load will be at very low levels, so the transmission will be also low, but it can't transmit. So when all these masks came to the governments, either from China or they started producing the masks, the new prophylactic measure is that everyone should wear a mask, whether he or she is infected or not, at least in places where there should be contact, like in a supermarket or in a clinic or in a hospital, because it does protect you from the air and from the asymptomatic ones. So the way, however, you described about wearing and taking off the mask is very important. And since people are not aware of this, I think that on Monday, I will also write an A4 page on why the masks and where it protects, what World Health Organization says about this, and how you dispose a mask, because these masks are disposable. I'm not supposed to be wearing it in the evening and tomorrow and the next day. So we need to know how to use them, why we use them now, because we are at second stage now. We have fought the virus, we have put control, we have put quarantine, but now we need to be protected from the asymptomatic viral load and viral persons, okay? That's the issue about masks.
Okay. All right. Volkan, you've been waiting for a long time. Can you tell us about Turkey? And we apologize for keeping you waiting.
No, doesn't matter. Good afternoon, everybody. Can you hear me clearly?
Mm-hmm.
Okay. In Turkey, first of all, I want to thank you for this meeting to inform us about different countries. In Turkey, the general situation is very severe, unfortunately. From 11th March until today, we have 42,000 people infected with COVID, and we have 900 mortality. Sadly, most of positive population is in Istanbul and in Marmara region. Day by day also increase number of treated people and become negative. So go out from the hospitals. Our governments take severe precautions to us. People with, for example, people with below 20 years old and over 65 years old, forbidden to go out from home. And people with chronic disease also forbidden and not to allow to work. And our Minister of Health also distributes everybody to mask and gloves every day for daily using. Without this stuff, to go out is forbidden also. In every cities, hospitals, official institutes, companies, people's measure their fevers before enter building, and if any suspected situation, these people's hospitalized urgently. So there is no missing positive situation. Unfortunately, we have 2 patients with thalassemia with COVID positive. 2 of them are from the Marmara region. One of them is a female, 32 years old from Istanbul. She infected from her husband. But she has no symptoms. Only the COVID positive. The government made tests, and she was positive. She's in quarantine now in her home. The quarantine will continue 14 days here. And the treatment with same with TIF Guideline, because all the associations in Turkey sent the TIF Guideline to hematologists, hospitals, or other public health places. And the treatment is now good for her. Hematologists give advice to take her for vitamins and zinc and also folic acid. She is fine now. She's just waiting to finish the quarantine. But in Bursa, another city in Marmara region, one male with 23 years old, he was positive 13 days ago. His symptoms with fever and severe cough. Urgently, he hospitalized. stay in infection service. He treated with antibiotics, antivirals, medicine used in also in pneumonia. He still had no transfusion now until now, but in few days, today or tomorrow, he will transfused and then charged from hospital. He is also fine now. It's better in situation. We have thalassemia, but no sickle cell disease. We have also a lot of sickle cell disease in Turkey, but we have no COVID positive sickle cell disease. In our thalassemia treating center, we have also severe problems about blood, shortage of blood. In normal time, our hospitals and university hospitals said that there's no need to blood donation, but during pandemic we have to find our donors to donate blood, and then we must take our transfusions. So every patient in Turkey it's angry with this situation. When we donate blood, also we have some problems. We donate blood with our friends or relationships, but our hospital takes us to 15 or 16th day blood. For example, one of my friends donate blood 2 days ago. I said that I want to take this blood, but the hospital says that no, you must have to take 15 or 16 days blood. But we have problem about this. Every patient said this situation is not good, and we have severe problems about that. For in our parliament we took this problem, and then they said we have to solve this problem, something like that. And also in our thalassemia centers, they have some rules during the treatment and transfusions. During pandemic situation, every day minimum 5 or maximum 10 patients take transfusions with different rooms in the hospital. First check their symptoms, for example fever, cough, or etc., and then take transfusions for patients. If any high fever or chest pain, make no treatment from doctors, and urgently orient to patients to infection service.
To infections? Rooms?
Yes.
Yeah.
Sorry,
special infection site, you said, or what?
Or rooms?
Yes, service, infection service we have in hospitals. Yes.
Like isolation services.
Yes, isolation. Yes, isolation service. The same. Mm-hmm.
Has any one of you in your country's experience addresses the blood supplies by advocating for more frequent intervals that blood donors can give blood? Because in extreme situations when there is very desperate blood supplies for the patients, one idea of the CDC and the others is to actually allow a shorter interval between donations of the blood donors, so that we can, of those blood donors who are really healthy and can stand a good hemoglobin. So in Albania or in other countries, and I see in Turkey there is a very severe shortage of blood. I think we need to advise or empower the governments, because I'm sure they know about all these policies, for this shortage of the intervals of the blood donors, so that more blood is collected. From the 2 patients that are infected with the coronavirus, do you know any of the history about these 2 patients? Was any comorbidities of the one? Was the one that developed symptoms was not well treated, was iron loaded, had diabetes? Do you know anything about it? To see why the one had impact on symptoms and the other nothing.
We have got information.
The female one is in quarantine at home, but also use medicines with Placule or Tamiflu or any other antibiotics or antivirals. She said that I use also vitamins and zinc. The doctors, our hematologists, said that you must take them also.
The other one?
The other one is in hospital now. He is in hospitalized and also antibiotics and antiviral medicine uses for him. And he had no still transfusions until 14 days. In 5 days, I think he will transfused. And then in 5 days, I think he become never. Now he has no symptoms. Hospitalized person has no symptoms now, become negative, just wait to transfuse and then go out.
Okay.
And I want to ask about the situation of sickle cell disease on TIF. What can we do about sickle cell disease? Because we have 4,000 person with sickle cell disease, and they ask every day, what about the situation? What about guideline about sickle cell disease?
Okay, Volkan, of course, as you know, sickle cell patients are in much greater danger than thalassemia patients, because they any kind of viral infection, even the flu, can trigger what is called the acute chest syndrome. The acute chest syndrome is very difficult to treat and can easily lead to death. So we regard sickle cell patients as a very high,
much higher than thalassemia.
A very vulnerable group. We are getting more statistics, in fact, concerning sickle cell patients, because we are in contact with the United States, and in the United States they are gathering adequate information. So we have at least, in the last count, at least from America, over 30 patients. Some of them have done very badly. Again, the majority seems to escape, but some have gone through a lot of adventure with acute chest syndrome, requiring respirators, requiring intensive care. So what I would say for your patients in Turkey is to make sure and alert the authorities. I'm sure the doctors know about it, but alert the authorities that this is an extremely highly dangerous and highly vulnerable group.
But also, in addition, TIF has posted a lot of information about sickle cell disease.
Yeah, I know.
The whole PowerPoint presentation saying exactly what to do for sickle cell disease, guidelines. Maybe I will collect those that are especially for sickle cell disease, and maybe somebody can translate it to Turkish, because there is a very good information about sickle cell disease that TIF has published. How to go, what to ask, what to refrain from. So let me send it again, only those that concern sickle cell disease, and perhaps you can take it to the associations with sickle cell or to your doctors. They need translation for the patients to understand. Yeah.
Okay. During pandemic, also sickle cell disease come to our Thalassaemia center. In normal time, they also take treatments in there. But during pandemic, they have no treatment in our center. Even if it's fever or in chest pain, they directly go to isolated area. And other doctors, our doctors give advice to go to other doctors, for example, in chest or infection service.
Okay, this is wise. This is wise.
Yes. Mm-hmm.
They should be hospitalized very quickly.
Yes,
Don't wait for the disease to progress. If they have fever, sickle cell disease should be hospitalized, but in isolation, of course.
But also for thalassemia, should you experience fever or any cough, don't wait until you see how it goes.
Yeah, also, yeah, of course.
Your doctor, it's very important. It can go very rapidly, or it can just die down and forget about it. But please keep in touch with your treating doctor, whatever. Okay?
Yeah, okay. Thank you.
Okay.
Anything else from our speakers?
I think Romania is on the line as well.
Ah, Romania.
Andrea. Can you hear us, Andrea?
I can hear you. Hello.
Hello, Andrea. Can we see you as well? Let's.
So in Romania is no case that was reported from authorities that been positive. I was with my daughter in 12th of March to transfusions. She was 9.5 and she got only one bag of transfusion. And in 13th March, she already go to 8. We got 2 bags of transfusions. We have problems with the transfusions. The donors don't came to donate. The media and the government made they made a campaign on media to make people to go to donate, but we only get transfusion if we have donors. If we don't have donors, they don't give blood, and the hospitals, all hospitals in Romania are closed. They only give to emergency, and they consider an emergency when a tall patient has 7 or 8.
Mm-hmm. Okay, this of course is quite difficult for thalassemia patients.
Yes, it's very difficult.
Yeah.
Unacceptable, I should say, because they go back years ago.
Basically, you have returned to a replacement policy for blood donation. In other words, you have to find your own donors.
Yes. If we have donors, we don't go. We go when we are sure that we have 2 bags donated.
Oh, but so Turkey as well.
Turkey as well?
Yeah, in Turkey also.
In Turkey also?
No.
Yeah.
And
yes.
If you don't have a family member to donate,
friends and relatives.
Friends and relatives, that you have to
yes.
to get transfusion.
Yes.
And the very big problem is they are just protecting themselves, medical. We have not figure out. We can buy masks. We should buy gloves, disinfectants. They don't give us nothing. They say don't have. And people donate to buy the necessary one in hospital. They buy massive masks, gloves, jumpsuits, but in the patients they give absolutely nothing, just for them. It's a big problem with this fact.
Andrea, can I ask you, are you being transfused in Fondani in the private hospital or in the...
No. In Romanian, we do transfusion only on state hospitals, and child are on oncopediatry, and adults are on another hospital in hematology hospital.
Yeah.
Pediatric oncology and adult hematology. Yeah.
Mm-hmm.
Yes, separate.
Yeah.
But we only go to hospital for emergency. They otherwise they don't permit us to go to hospital for a neck or for anything else.
Mm-hmm.
They are very strict.
Mm-hmm. Yeah. Yeah. Okay.
Thank you very much.
Andrea, thank you. I think we've got France left.
Yeah.
Ali.
France and Ahmed and Ksena.
Ah.
France and Ahmed Garouni.
Oh, we've got more.
Three,
okay.
only three. I'm just
three.
Ali Sardar.
Ali from France.
Yes, I'm here.
You're with
You
us.
hear me?
Yeah,
yes,
we hear
Did
you.
you hear me? Hello, everyone.
Mm-hmm. What's the situation, Ali, in France?
So in France, for the moment, we don't have a storage of a shortage of blood. Normally, we have 1 month reserve in the transfusion center of blood, but I see at the TV, campaign TV and media for donors to go and the blood. I can ask for. I can talk about my center in Paris, near Paris. The Dr. Professor Galacteros sent us a message who told us if we have any symptoms, we should call the center, and we will have a treatment with hydroxychloroquine and antibiotic. I think in Marseille is the same. What else? I know personally 2 cases of thalassemia patient with COVID positive. They were at hospital, and now they get out of hospital. They took the treatment. I don't hear.
Difference.
I didn't hear the question. Sorry.
Okay. Yeah. What Professor Galacteros is doing seems to be different from other centers. In other words, if the patient has symptoms, they not only say stay at home, but they also give them hydroxyquinone.
Yes. They told us to, if we have any symptom, to call them at first, and they give us if fever and other symptoms, they give us hydrochloroquine and antibiotic.
At home, yeah. You receive this treatment at home.
No, I don't. I guess we have to go to the hospital before that.
Mm-hmm. Okay.
And now they go to the hospital, they give instructions, and then they take the medicine at home.
The treatment is only reserved for the hospital patients, not at home.
For those that need hospitalization, probably. So we need to contact us about it. Thank you very much. Blood supplies are okay?
Yeah, he said that.
Yes.
Mm-hmm. Okay, Ali, thank you very much indeed.
You're welcome. Thank you.
Who else do we have? Ahmed Varoglu.
How are you?
Hello, everyone. It's very nice to meet you, and I'd like to thank you to TIF that organizing this webinar meeting, so that we have something to do at home.
It's good.
Like the old days, anyway. I just want to do a little summary about what's going on at the northern part of the Cyprus. Here, since 13 of March, it's been 28 days that we are in lockdown at homes, and the government is only markets are open, pharmacies and gas stations are open. All other offices and others are closed. So at the moment, about the country, I can say that there are 96 positive cases, and now at the moment only 49 patients are receiving treatment, and we have unfortunately we have 3 deaths from COVID positive. Two is from the Germany citizens, and 1 is from Cypriot.
Yeah.
And what we are doing in thalassemia side is we have shortage of blood, very shortage of blood. You know, in this part, we are also complaining about the shortage of blood, and after the COVID situation, there are more shortage of blood now. Unfortunately, government is doing nothing about this, and we as a society and we are putting an action for the shortage of blood in social media, Red Crescent, press and volunteers and NGOs to donate blood. And we have, as a society, we have written an official letter to the Minister of Health and the Prime Minister yesterday to announce that people to go to donate blood. We don't know the answer yet. So what else? At the hospitals, we don't have any thalassemic positive cases, thanks God. In our center, 150 patients are treating about thalassemia. And wait a minute. We are taking properly precautions in the centers, and maximum 12 patients every day. And some of our patients are in a psychological way panicked than the other patients. They have more panic than some others. They directly think that what's going to be happen if they don't find any blood or transfusions, and they will catch the COVID very easily. So they're in a little bit panic than some others. And the standard treatments like MRI, echo, and the other blood tests are stopped at the moment. We only receive transfusions and chelations at the moment. So the people and all the citizens respect to the social distances and the protective rules. And this is I think a brief summary which I can do it from the northern part of the Cyprus. We are trying to motivate our friends, and but we have a good chain between patients, and we have been, for example, I am trying to do some other officials and talking with the press about the shortage of blood, and some other friends are helping each other to find blood from the other citizens and friends.
Ahmed, can I ask you then, is if there is shortage of blood, does the hemoglobin, pre-transfusion hemoglobin, is it much lower than before?
It is lower than before, but in general, I haven't seen any very low, very low hemoglobin in every thalassemia. It's the lowest hemoglobin that we go to transfusion is 9, but this is because of that our patients are very looking to each other, and one patient is finding blood to another, and the others are finding to another, helping each other, and our doctors from here, I can say that very looking to the patients are very closely and doing some advices. But to tell in my position that I would like to ask, and I'm very worried about if any patient will catch a COVID. What is of course, I heard about the first step is to go directly to the hospital, but we don't know what's going to happen at the end of the day. Maybe nobody knows, but this is a very serious question in our minds.
Okay, thank you, Ahmed. I think the blood supply, which is okay now, it's because the period is still soon. Okay. If the period of daunting continues, we are surely going to have problem with the blood supply. Now, yes. Hemoglobin is 9 because, okay, one friend helps the other, one family helps the other, one patient helps the other. But if daunting continues, there is going to be a problem, and we should find some solutions for the governments to see what we are going to do. Okay, with regards to what happens if a person is infected, I think we should all be very hopeful because there are new drugs. There is repositioning of drugs. There is, okay, vaccine is going to take at least 12 to 18 months, but it's going very, very fast. But many drugs and combination of drugs are on the scene. On Monday, you will see TIF's guide on vaccines and therapeutic drugs. It's about 16 pages. And there are all the drugs that are being used now for therapeutic purposes. So we are hopeful that coronavirus infection is no longer alone, but is with the company of drugs now. So let's be hopeful.
So the TIF will, so the TIF, Dr. Andrula, allow me to ask something. So the TIF about the therapeutic drugs on Monday, so that we can advise our doctors if something happens.
Yes. We will.
Is it true?
We'll send you a special letter as well. Okay.
Thank you. So there is only one patient left.
I am very happy to see all friends from here. So I hope that to see you soon.
Thank you.
Thank you, Ahmed. We're also very happy. Kseni from Albania. Kseni, are you with us?
Kseni Manikou. Do you hear us?
Hello.
Hello.
Can you hear me?
Yeah, we hear you. Yeah.
We don't see you, but we hear you.
I can hear you. Okay, my internet is so poor, so I want to add something about Albania that Georgie said about the blood bank in my country. We are in the situation that we are shortage of blood, and they announced that due to this situation, the patient with thalassemia or sickle cell disease, they are giving only one blood bank, not two or. Do you hear me?
Yes, we hear you.
Okay, and the local authorities in my country are offering transport or help for anyone who wants to donate blood, because we can go out without permission, so it's difficult in this situation.
Okay. Do you know of any cases that have been infected, Kseni?
In total, or with thalassemia or sickle cell disease?
Both.
With sickle cell disease or thalassemia, I don't know exactly because I don't have any information, but we have in total 460, I think so.
Yeah. Mm-hmm. But none of them infected by the virus?
None of them.
No. Okay. All right. Xeni, is there any other problem you want to tell us about?
Yes. The last month I ran out with hydroxyurea, and I had difficult to take the permission to go medicine, so it was a problem for me.
Yeah. Okay, so there is difficulty in obtaining. Now, can I ask one question about Albania, because I've lost touch a little bit. There was a problem in the past of getting MRI T2 star. Are you now able to be followed? I'm not talking about the coronavirus, before the coronavirus.
Yes.
Do you get your T2 star measured every year?
No. Unfortunately, no.
Okay. Do you know the reason for this? Because I know that there was a machine, there was a scanner, of course, and two in Mother Teresa Hospital, and there was one in Durres.
Yes, I know this, but there was non-specialist to do this, I think so, and they cut off and you can do it in private hospitals.
Yeah, okay. All right, thank you very much.
Okay, thank you.
Anton online, please.
Yes, Anton.
Yeah, you can go ahead, please. About Cyprus.
Yeah.
Yes, okay. Now, as I'm pleased to talk about Cyprus, as I live in Cyprus now. Now, Cyprus has been affected by the blood donation. Blood donations has a little bit dropped, yet this does not have a big effect on patients. So patients, instead of all patients that used to take 2 units together, now they are taking only 1 unit of blood, but they go more often. So more or less, their hemoglobin level stays the same. You cannot manage to go like every week instead of every 2 weeks. These have a little bit, just a little bit, their hemoglobin has dropped, but it's merely their mistake, not as a mistake or negligence or inability of the thalassemia center to manage them. The opportunity is open, and they can keep their hemoglobin the same level if they want, or if they can manage it. And when they dropped a little bit, it's like instead of getting transfused at 11.5 or 12, they get transfused at 10.5, 11. So it's not like a big drop, or maybe 10. So it's not a drop like that it can affect their health. The very impressive thing is that the safety procedures that the unit has taken, first of all, they have, like the center have got 2 entrances, one entrance for if you want to go to the doctors to draw blood, whatever, and the other for getting transfused. Now, one of the 2 entrances has been closed so that you go from the same entrance and you get questions and screened. They take your temperature, they ask questions, symptoms, like if you have okay, if you have fever, they check it, like if you cough, if you sneeze, if you have chest pain, if you have throat pain, all of these things. At the beginning, when traveling was allowed you to ask you, have you traveled in the recently or just these last 2 weeks, anything of the sort. So if it's everything is okay, you can enter ordinary. They have a special room specified for if a patient get infected or get affected with COVID-19, they use this room for only the affected patients. Now, the patients have been divided into 2 groups, Group A, Group B, and they don't go on the same days. They go on different days. Like, let's say Group A have got 3 days that week, and the next week they get 2 days, so that Group B can have 3 days, 2 days, and 3 days. Yeah. When your blood reaches the thalassemia center, they send you a message like, come, and they specify what time you should go so that the center will not be crowded with patients, and the patients can be separated and they can have the adequate distance between each other, like more than 2 meters from each. They have the rooms, the beds are very well distanced from each other, like more than 2 meters between one bed and the other. And these are really very well and very impressive procedures.
Yes, I think Cyprus has taken from the beginning, the thalassemia centers have taken from the beginning very, very strict measures. We thank all the healthcare professionals very much.
And the government have advised all vulnerable groups, among which are thalassemics, not to go to work. Not to go to work, stay at home. And their salaries have been compensated of between 60 to 75%. So even not going to work, they can still get their percentage of their money. They can still manage. They can still buy whatever is needed. And, since the beginning, I think Cyprus has been doing very well with the restrictions, with the restrictions, with the courses, procedures, all of these things. And, I think thalassemics are doing very well, except the case that just notice have mentioned. We didn't hear about any other case.
Mm-hmm.
Thank you very much, Anton.
Anton, thank you very much indeed.
Welcome.
So we have to say goodbye to everybody. Thank you very much for your participation.
A very quick.
Please let us know if you have any news. Don't wait for us to ask you. You know, you are Community Advisory Board of TIF. Please, as soon as you hear something, thalassemia or an infection or anything that affects you, write to us, please, because we need to concentrate the information. We need to support you. And before we close up, let me tell you that today is Michael's birthday.
Happy birthday, Yatri.
Happy birthday, Dr. Michael.
Happy birthday.
Happy birthday,
Happy birthday,
Dr.
Mike.
Happy birthday.
Every year. Okay.
Michael, hello.
Yeah.
Just before you go, a very quick question. I don't understand the science behind it, but apparently if thalassemics get infected with the coronavirus, something weird happens to their release of iron. If I'm correct what I wrote, maybe I didn't understand, but there is, if you have the coronavirus, then all of a sudden your iron that's stored up gets released into the bloodstream or something like that. I don't know.
Yeah, no, it's not as simple as that. You're talking about a very complex process that
Yes.
does affect the hemoglobin molecule and the heme part of the molecule, which carries the iron.
Okay.
At the moment, however, we have not had any reports, and we don't know yet. This is the theoretical part. We don't know if this actually results in a hemoglobin drop. It might be just a physiological response, but we don't have any evidence that it causes a severe hemoglobin drop.
Can you do me a favor? Can you communicate with Antonio?
Yeah.
Because I think it's Antonio who I saw something somewhere written, and I think it was Antonio.
Okay.
With regards to this, I as I said, I didn't understand it very well.
Okay, it's not easily understood, but the clinical significance is not great. That's what we know.
But it's probably got to be related with the oxygen part of the story.
Also, I don't know if this is what you saw. You expect the ferritin level to go high.
Yes. But also the iron release.
Yeah, but that's not. No,
that's an infection marker. It's not an iron related.
This isn't iron related. The ferritin will go up with any inflammation.
Yes, I'm aware of that one. It's just my concern is the iron release. Yeah. Anyway, please look into it if you can. Thank you, and happy birthday.
Thank you, George. Keep well, everyone. Keep well, Ahmed, Anton, everyone. Bye-bye.
Bye, everybody.
Bye-bye.
Keep
Thank
well.
You.
Bye.
Thank you. Bye.
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 Bye, everyone. Thank you very much.
Hey.
Bye, my friend.
Listen,
Bye.
go and shave. Go and shave, will you?
No.
Go get a haircut, George.
Must, man.
I can't go out to have a haircut.
I know, me too. Look at me.
I know, it's ridiculous. Take care. Look after yourselves.
Yeah,
bye.
Bye, George.
Bye.
Bye, Riyad.
Bye.
Bye, everybody. Bye, Anton.
Bye-bye. Ciao.
Bye-bye.